So a couple things kind of stand out kind of right off the bat. Number one, he has a fairly large erector bulk in lower thoracic spine, which is common in people that don't move well in the lumbar spine. Okay? Which he's had surgery, so that's probably why. But generally, we should see a nice erector bulk that comes into the lumbar spine. Okay? Now, it's a little bit tougher to see in the lumbar spine because you have more thoracolumbar fascia in the lumbar spine, which kind of covers that. But there should be bulks of erector in the lumbar spine. In his case, we see a lot of it in lower thoracic area. And we don't have a huge lordosis. More of a, he's not necessarily in flexion, but he's more straight through the lumbar spine. So this is information for me because I can start to tune myself into just these very simple observations, because where do we think he's not going to move well from? Probably down here. Let's go ahead and start from here and start to round yourself up. Good. The head tucks right at the last bit. What are we observing for? We're observing for areas that don't move. We're observing for areas that move a lot. So what we should see is that the movement starts here. It goes through the lumbar spine, because we didn't ask him to get super segmental yet. It goes through the lumbar spine, it goes through the thoracic spine, and then he tucks his head. Okay? He doesn't hinge his head, he should start to tuck his head. And then from here, we're going to ask him to reverse, and it should start here and move its way back up again. So start to come down. Good. What we should see all on the way down, don't go down yet, is the pelvis should rotate, the lumbar spine should start to drop. What should it drop into? Extension. Let's go. Where does he drop from?
Thoracic.
Right here. And then he moves a little bit up through here, and then he has a little dead area right here. And then he extends his neck. And so we're kind of seeing that maybe this area, consequently right where the surgery was, right where the scar is not moving. Right? And continue to move up from here. So, continue to go up. Is this part of the thoracic spine moving? No. Back down. Why? How do we know that?
Stays the same.
Because it stays the same. Start to go up. So right here, stop. No movement. Right? Right here, movement. Keep going up. Now, is he getting movement up here? No, why? What's moving? The scapula. What should be moving? His spine. Hey, let's try not to move your scapula. Okay? We can give him that cue. Right? We can give him that cue and say, hey, I notice you're moving your scapula. Try to get this in here, pack this in here like this. Okay? Now, continue to come up. That was better, right? So now we're starting to get a little bit better assessment of the thoracic spine. Come back down. Right here. Up again. So let's look right here. Movement? Little. Not a lot. Movement? Movement? Come on back down just a bit. Up. Movement? Not really.
No.
And then he gets some up here when he starts to dunk his head forward. Right?